Hi everyone, and welcome to another super special VN Happy Hour.
Woohoo! Yay!
I'm Vet Times editor James Westgate,
And I'm VN Times editor Rachel Buzzell.
and we'd like to say that this Happy Hour is brought to you in association with Bought by Many, voted Pet Insurance Provider of the Year at the 2021 Moneyfacts Consumer Awards. They work with vet nurses and owners to help pets have happy and healthy lives. Join their Many Nurses Club on Facebook to connect with other vet nurses and get a £50 Amazon.co.uk gift card when you take out a Bought by Many policy. Bought by Many's complete policy offers dental cover for accidents and illness with its 15,000 vet fee limit. Visit their website to find out more. I'd also like to add any guys on here tonight from Bought by Many, let yourselves be known in the chat. We'd love to hear from you. But tonight we're going to be focusing on all things dental, from scaling and polishing to owner compliance, as well as how vet nurses can get involved in this speciality. To help us do that, we have our special guests ready and waiting to share their knowledge.
That's right. So in our main interview slot this evening, James will be chatting with Claire Harrison. Now, Claire has spent the majority of her career in the veterinary dentistry referral. She was the first RVN, in fact, outside of North America to gain BTS certification in dentistry. And she is also an active member of the Academy of Veterinary Dental Technicians. Claire will be answering questions which have been sent in by you guys about her passion for dentistry, the VN's role in this speciality, and how you can all get involved.
That's right. And straight after that, Claire will be joining our other guests for our panel discussion. We've had loads of questions sent in, and I know we're all looking forward to sharing their thoughts and opinions with the Happy Hour community. So joining Claire on the panel, we have Claire Bloor, who holds a BVNA VN certificate in dentistry and is excited to be delivering the new RCVS accredited certificate in advanced veterinary nursing dentistry course at Myerscough College in September.
Okay, and we are also delighted to welcome Nicola Lakeman back to the panel. Nicola has written for many veterinary textbooks and publications, and she's also a regular contributor to VN Times, and she is currently studying for her master's degree in advanced veterinary nursing with Glasgow University.
And of course, we've also got stacks of prizes to give away this evening, with £100 up to grabs for our picture challenge. We've had loads of entries, haven't we, Rachel, so far? But keep them coming in. We'll be announcing the winner at the end of the show.
Yeah, we've had some absolute corkers over the past few weeks, but yeah, please keep those coming in. The email is happyhour@bbd.co.uk. And the winning picture, obviously, that gets our £100 prize voucher, so it's well worth entering.
And we'll also be naming the winner of this month's Pay It Forward prize and announcing the two winners of our regular popular Top Tips competition. I almost lost my way there. And I've also got to mention the return of our VN All-Star Jack Pie, who's going to be running a quiz. We normally have the Lee and Nikki show, but we've got the incomparable Jack Pie in the house tonight, who's going to be asking a few VN-related questions as well. So we thought we'd give you a plug there, Jack. Welcome back, mate.
Yeah, welcome back, Jack. And we also have another Jack Fortune, leading our fitness session. So for those of you that want to work your muscles a bit, you will be joining Jack Fortune. But before we get started, please don't forget, Happy Hour is all about you guys. So please get engaging in that chat box. We absolutely love hearing from you. If you're feeling a bit shy, you can private message myself, James, Ebony, Katie, or any of the panelists, and we'll be happy to put the question forward for you or answer any questions that you have. And if you're on social, please share that you're here using the hashtag VN Happy Hour.
As per usual, we've tried to cram as much into this hour as we possibly can. So let's get this show on the road and say hi to Claire Harrison. How are you doing, Claire?
Hello, I'm fine. How are you? Thanks.
Not too bad, not too bad. As per usual, all the questions have been sent in by our delegates tonight. We've had stacks. We can only answer and ask a few, but so we'll get going with the first question. What is the Academy of Veterinary Dental Technicians, and where do vet nurses fit in?
Oh, I'm really excited to get to talk about the AVDT, as we call it for abbreviation. So the Academy of Veterinary Dental Technicians is an organisation which promotes both dentistry, veterinary dentistry, and also the technician or nurse involvement in that. So it's an organisation which delivers the veterinary technician specialty in dentistry. So experienced veterinary nurses or technicians can undertake the 2-year credentialing programme, and then once they've done that and they pass that, then they can sit the qualifying examination. And then once all that's passed, then they're awarded their VTS in dentistry. And then members have to be actively involved in the organisation and also recertify every 5 years as well. So it's something that veterinary nurses, maybe after about 3.5, 4 years plus of post-qualification, can they start to think about getting underway with a VTS. And the best websites to look at if you're interested is the avdt.us. So that's for the Academy of Veterinary Dental Technicians. If dentistry is not your main passion in practice, but you would like to do something else, then have a look at the National Association for Veterinary Technicians in America. So that's navta.net, navta.net, and you can have a look at all the different specialties that are on offer, and there's about 18 currently.
That's an awful lot, and I can imagine that opens up an awful lot of doors. A lot of work, but a lot of doors open.
A lot of, yeah, and there's not only sort of work opportunities, but all those sort of extra things like speaking and teaching. Yeah, and Nicola's just put up in the chat that a VTS is well worth exploring. So she's a VTS in nutrition, so you know, it's something that not a lot of veterinary nurses in the UK have. My guesstimate at the moment is there's around 100 veterinary nurses that have a VTS, a majority in either emergency and critical care or anaesthesia and analgesia. So, but it's definitely something to explore if you are very passionate about something.
A real USP. But cracking on to the next
question. They're
definitely
international, not just, you know, for North America.
I suppose following on from that, and that's a great answer, a lot of information. I hope people have been making notes, but do you see more veterinary nurses looking to develop the skills in the field of dentistry, and if so, why?
Yeah, I mean, dentistry's grown massively in the past sort of 15 years that I've been involved with dentistry, and we're hopefully getting some more specialists in the UK. So there's going to be more specialty centres opening. They're starting to get people in to do specialty dentistry in the multidisciplinary centres as well, and there's also the postgraduate certificates available for veterinary surgeons as well. So I suppose as they start to, you know, up their qualifications in dentistry, then they're going to be looking for nurses to join them as well. And also owners having more of an awareness and higher expectations of oral health care as well. And because the nurses can be massively involved in dentistry and quite involved in the procedures as well, and nurses that enjoy consulting as well, they've got that opportunity to develop clinics and as well as be involved in dentistry. And that goes for first opinion practice as well.
Okay, yeah, so stacks of opportunity. Next question. Back in the day, nurses often did the dentals, including extractions. There were courses, especially for nurses, to teach extraction techniques. Will nurses ever be able to do extractions again? Qualification could be designed for this.
Yeah,
potential hot potato.
A crystal ball for that. Yeah, and it's
yeah.
obviously a bit of a, you know, controversial you know, subject as well. I think it's something that is under consideration that the VN Futures have looked at, and you know, I suppose it would have to go through a lot of legalities. I think the main problems with it are, you know, veterinary nurses maybe being put in a position where they don't feel, you know, qualified or competent enough to do that. And also dentistry, you know, things can go wrong pretty quickly. Extractions are oral surgery, so unless it's something very straight, you know, not straightforward, but the tooth has got a lot of dental disease there and it's very mobile and going to come out quite easily, then I've seen quite small teeth and, you know, single rooted teeth, and the vets have struggled for quite a long time to remove those. So I suppose it's about veterinary nurses having a really good understanding, underpinning knowledge of dental pathology, and then do we cross over into the lines of making diagnoses before we're performing dental extractions? And the veterinary surgeon would still be, in charge of that. So I can see there's, how it's controversial, and there's very many differing opinions on that as well.
Wow.
But I think it would have to be quite an involved qualification if they were going to do one for oral surgery for nurses.
I think you handled that particular hot potato very well.
Right. Okay.
Quick answer. You've got 20 seconds to answer this one.
Okay.
What are the main positives of dentistry, and what do you like and why?
Oh,
I'll give you
I suppose
30 seconds.
Okay, thanks. I suppose the benefit that you make to patients, the oral pathology is often very hidden because animals are very stoical, especially our dogs and cats, when it comes to oral pain. So also the communication with the team and also the clients as well is what I enjoy the most. And what I don't like, I suppose, is that non-compliance from owners, and also a bit of an apathy side on the veterinary side for recommending dental procedures. But I think that comes down to education rather than anything else.
Good stuff. And where do you stand with polishing teeth after scaling? My vets have had conflicting advice.
Yeah, I think in most of the literatures in veterinary dentistry, it still promotes polishing. I think the thoughts with that are you can damage the teeth if you're a bit overzealous with polishing. So it's something that I still do. I do polish as long as you use a fine prophy paste so that you're not wearing off the enamel with a coarse paste. And so it's entirely down to the individual practice, but you're not going to be causing, any damage as long as you're polishing gently. But also if you miss that step for some reason or another, or the vets choose not to do it, then there's probably not going to be much of a issue there.
I'm considering dental as an area for the practice to develop, but the partners aren't sure. What are the key benefits?
Oh, wow. I suppose, your benefits to your patients, first of all. It could, if you develop a really great dental service within your clinical practice, then you're going to be quite attractive to owners, I think. If your dentistry is something that animals will need several times throughout their lifetime, at the very least, whereas they're only going to get neutered, or a lot of other common procedures are only going to happen once. So dentistry is something that's going to be quite repetitive throughout an animal's life. So you've got that there. If the owners of the practice or the partners are very reluctant, then get them to have a look at the American Animal Hospital Association dental guidelines. They're updated in 2019, and it gives you a good gold standard for what you should be working towards as a practice. And there's also the World Small Animal Veterinary Association guidelines as well, but that's a huge document. So the AHA guidelines are a good one to start with.
Great stuff. Now, you've part answered this in one of your earlier excellent answers, but is there a limit on what VNs can and can't say about dental procedures in terms of advice at dental advice clinic?
Yeah, I think in a way we're quite fortunate, as in we can't often diagnose a lot of dental problems in the consult room. So the animals have to be safely under general anaesthetic and undergoing an oral assessment for us to know exactly what the problem is. So you can often show owners that there's a lot of issues with the mouth, or there's a lot of tartar on the teeth or inflammation there, and that you're recommending a dental procedure. Often they might come to you after they've been into for a vet appointment for something else, and the vet's recommended that they come and see you, or you may be seeing them post-operatively as well for post-op rechecks. So I think as long as we don't stray into diagnosis, we can safely cover what to expect during a dental procedure and what may happen as well, and what is involved.
Great answer. A vet is really interested in developing our dental services and asked if I'd want to work with them. How could it develop me?
Well, there's loads. I suppose there's lots of CPD. You could do either, you know, some online courses together to get, you know, a taster for it. Vets and nurses, if they go and do a course in dentistry, they get really excited and think about all the things they can take back to the practice. So it's really nice to see when they're working together about how they could develop that side of the practice and how they can get more interested in it as well. And then there's always the opportunities of doing a certificate, like the new one that's at Myerscough College, the Advanced Nursing Certificate, or say the NCERT in dentistry as well, the nurse certificate from Improve International, or even if you become really keen on dentistry, then think about the VTS as well.
Of course. Another potential hot potato coming your way.
Wow.
Do we see VNs getting more dental responsibilities under the RCVS legislative reform plan? And what could these be?
Well, I suppose the extractions would be the one that would be quite contentious. But at the moment, nurses can do, you know, a crazy amount in dentistry. We can take all the radiographs, we can do all the oral assessment and the charting, scaling, polishing, you know, quite involved cleaning as well. So we're maybe cleaning out periodontal disease pockets where there's periodontal disease. And these teeth aren't going to get extracted. We can place the local blocks as well. So as long as you feel you're happy to do that, you're competent, you've done some further training, you've got support from your vet as well, then you can do all that already. And I suppose that giving us that opportunity to develop the client contact side as well with our nurse-led clinics is really valuable.
So there's already a lot you guys can do.
Yeah, so I think it would just be the, you know, the extraction side of that, and how would we, you know, define those barriers between, you know, when things become, when is it a simple extraction, when is it oral surgery, and how would we involve nurses in that as well? And I think it would be very difficult to make those lines clear.
Yeah, it's always a challenge when anything like the legislation needs to be unpicked. But moving on to your final question, could you explain how a vet nurse fits into dental referral and how this differs from working in first opinion practice, for example?
So, I mean, a lot of that initial stages that I talked about in the last question are something that I do every day in dental referral, but also I'm involved with you know, the advanced procedures as well. So there's, you know, you're assisting with maxillofacial surgery, you're involved in the root canals, so they're actually something that's quite heavy, you're heavily involved in with assisting with the equipment and during the procedure as well. Some veterinary dentists, when they're doing crowns, you can be taking the impressions of the mouth as well. So there's loads to be doing, but you know, my main job is really doing the radiographs, speaking to the clients, doing the admits and discharge appointments as well. So it's not something that you lose completely when you go to dental referral. But I'm sure they vary from centre to centre though.
But something you clearly get an awful lot out of professionally.
Absolutely, yeah, yeah. I wouldn't want to do anything else whilst I'm in, you know, clinical work.
Yeah, it's something to get your teeth into, excuse the pun. I've been waiting to drop it in all night. But that was absolutely fantastic. Thank you ever so much for that, Claire. Now, Claire will be joining our other Claire, Bloor and Nicola Lakeman, for our panel shortly. But we have got a little poll from our sponsors, Bought by Many now. If you'd all get your fingers on the buzzers, we'll just wait for our wonderful tech team to bring that up. So yeah, there is your poll. I suppose I could talk through some of the questions. Who does dental x-rays as standard in their practice? Is there enough education for owners about dental health products? And do nurses regularly scale and polish teeth in their practice? I'm interested to see what the answers are on this, actually.
I can see the lines going now.
We'll give this a few more people coming in and voting. We'll wait until we've got.
While that's happening, there's been some really great chat around people's practices within this wonderful community with dentistry as well, from having specific dental days, so it's not just at the end of the day, through to the pricing structure, so having, you know, a cheaper pricing structure for a grade 1, encouraging people to do that at a set price, so that actually people invest and prevent, rather than waiting for things to get bad before they intervene. Yeah. Which has been great. So some really, really great sharing from the richness in the room.
Yeah, that's something we've seen actually out in some of the practice profiles I've done. That sort of set pricing structure has been something that has proved to be a really effective tool to get the numbers of dentals up. I guess that's perhaps something that puts people off when things start to escalate. Yeah, we'll give this a few more minutes.
Awesome. We are at 80% of you nearly having filled this out. It looks like there'll be about another 7 or 8 of you. If you are happy popping in the answers to those as well. Yeah.
If not, time waits for no man or woman, or indeed vet nurse. So we will also drop in a reminder about our challenge, because of the theme being dentals. We've been asking people to send in their challenge pictures. And
what's TV? What do you watch?
Please keep those smiley pet pictures coming in. Happy hour at vbd.co.uk.
That's the one. So we've already had a bunch, but we'll be hopefully showcasing some of those after the poll. But and then of course we have our panel discussion, which again, it's all questions sent in by the delegates, so hopefully you'll be hearing your question asked very shortly.
Right, we've had nearly 90% on that, James, so I'll end that now.
Pretty good. That's pretty good. Fantastic. Well, thanks for that, guys, for taking part in that. And as I say, get those challenge entries sent in to us. We'll be giving away £100 to the winner of that. I think that's a very generous prize. So we've had plenty of picks sent in, but we are now just about ready, I think, to move into our panel discussion. So are you ready to roll? Kick us off, Rachel?
Yeah, absolutely. Right, Nicola, I'm coming to you first. First off, welcome back. It's great to have you back. So your question is, have you got any tips for removing bad staining without damaging enamel? Oh. Are you there, Nicola? Can you hear me?
She was there a minute ago.
She was there a minute
All right, she's
ago.
just muted. No. Have you just unmute yourself?
Yeah, can you unmute me now?
Yeah, you're unmuted now.
Nicola, you're back.
Back in the room.
It said I was a participant and I wasn't allowed to unmute myself.
Oh no! You need me to repeat the question.
It was about staining, I believe.
That's right. Yes.
I heard you. Yes. So I see a lot of these in clinics, and I like analogies. So I liken it to my daughter's school shirt. So we all have that white school shirt, don't we? That's always stained. And getting rid of the stains is really, really difficult, but it doesn't actually affect the structural integrity of the school shirt, does it? It's really cosmetic. And what we find is, same as with our teeth, when we use whitening products, they actually contain bleach. And I know in the UK, we're very, very strict on the amount of the bleach that's in our products, because they really can affect the enamel quite a lot. What's important in nurse clinics is our role is to educate owners. I think that's really important. And I think it's educating them more about brushing the teeth, getting rid of the plaque, not allowing the tartar to build up, and just getting that across to say that's the important aspect.
Great stuff.
That's a great analogy. I love that.
And this one's for you, Claire B. What's the best way to reduce pain in tooth removals apart from a block?
Hi.
Hello.
Well, that's a really good question. And I'm very pleased that the question actually acknowledges that blocks should be used, because local anaesthetics really are superb, and I would urge all practices to use them. But I suppose in addition to blocks, or instead of blocks, other ways to reduce pain would be a really good multimodal analgesic plan. So that would incorporate local anesthetics, but the use of drugs from different categories to target different stages of the pain pathway is really important. Well-maintained instruments and equipment. So a lot of the instruments that we use in dentistry are sharp, and they need to be sharp for a specific reason. So they do need to stay sharp to do the job well, and if they don't, that could cause excessive inflammation and therefore pain. And I suppose the other two would be good surgical technique and pre-op radiographs as well. So with regards to surgical technique, good tissue handling, good manipulation of the tissues by the operator will again reduce inflammation and tissue damage and therefore pain. And pre-op radiographs might sound like a bit of a strange one, but to check for any abnormalities prior to the start of the extraction is a useful thing to do. So checking for anything that might affect the extraction, for example, there being no roots there, and digging around for something that's resorbed. Ankylosed roots that might make the extraction more difficult. Things like dilacerations, so abnormal shapes to the roots, which could affect the extraction and make the vet be digging around for something that's really quite difficult. It just causes more trauma and pain. So a few different things, really.
Loads of stuff. Thanks for that, Claire.
Okay, I'm coming over to you, Claire H. Would it be fair to say that an increased focus on dentals can develop into an important revenue stream for practices? My practice is not the best at this, and I want to push my cash for more awareness.
Oh, okay. So yeah, I mean, it can be quite a profitable service, but it's got to be done quite efficiently, which I think getting your standards up in dentistry and getting everyone more experienced, or having a set team that are more experienced in dentistry is key. Maybe looking at staging dental procedures or putting time limits on procedures so that things aren't, you know, the vets aren't getting fatigued and, you know, things are running into extra time because, you know, of operator fatigue rather than you know, the fact that it's just a very long procedure. Also involving the nurses more, because if we're staging dental procedures or we're getting patients in having a more awareness, so vets are recommending dental procedures sooner rather than waiting until animals have really bad teeth and there's lots of periodontal disease there, they're needing lots of extractions, then the nurses can be doing the majority, if not all, of that procedure. If it's, you know, staging with the dental radiographs and cleanings. So I think that would be more effective for practices, and utilising their nurses much better as well. And eventually it would see an increase in revenue.
Wonderful, some great advice there, thank you.
And this one's for you, Nicola. Do you have any good advice, and I'm sure you do, for setting up and running a really good nurse-led dental clinic?
Well, I'm going to actually say all nurse clinics are dental clinics. Every animal that walks in your door has teeth. So every animal, every part of your clinical exam is looking at its teeth. So it's quite a difficult question to answer, because every single animal we should be, I think we call it lifting the lip, don't we? And just having a look at seeing what's going on. You know, if you said to someone, I'm sure most of you will drive, if you could lift the bonnet of your car and visibly see that there was something wrong, would you do it? And you would all go, yes. So why don't we do that for our pets' mouths? It's a really, you know, obviously some dogs and cats, you know, you're not going to get near, but it's part of every single nurse clinic that we see. It's a really important aspect of that. You know, dental health, mouth health is really important for your renal patients, for your cardiac patients. You know, the first thing that we recommend for cavaliers with cardiac problems is that we, you know, get their mouths all sorted out and cleaned. So every animal you see, we should be doing that. It's part of our, you know, clinical exam. So all of them.
Thank you very much.
Okay, over to you, Claire B. I'm really interested in the Advanced Veterinary Nursing Dentistry course. Could you give me some more information, please?
hopefully. Yeah, absolutely. So the course that we're running at Myesco is it replacing the RCVS diploma in advanced veterinary nursing that's been running for well over a decade now, and it's because the RCVS decided to change their postgraduate or post-registration framework of qualifications. So yeah, it's basically a one-year academic course, part-time study via blended learning, so that's mostly online with 4 trips to college, and you'll study 3 20-credit HE modules. So one of those is focused on sort of evidence-based nursing, developing your research skills, critical thinking skills, your HE skills basically. So you can focus on evidence-based practice. And then there's 2 modules that are focused solely on dental, oral and maxillofacial conditions, treatment and nursing. And once you've completed all 3 modules after the year and attended graduation, etc., you've got your certificate in advanced veterinary nursing dentistry from Myesco and the university, and then you can claim recognition of that qualification from the RCVS. So you have an RCVS cert AVN. And yeah, it just involves a range of assessments to test your theory knowledge, but develop your skills and protocols. And it's very much focused on practice learning, because that's where the learning needs to be useful for you all. So yeah, I'll not really bore you with anything more. If you want more info, then you can by all means email me and I can send you some more details.
Fantastic. And that's
I'm excited though.
Yes, very excited. It starts in September, doesn't it?
It starts in September.
Yeah, wonderful. And I think I've seen a link to the course go in the chat. So of course, go and have a look at that, and we'll get your email there too, Claire, if you're happy for us to. Wonderful. So I'm coming over to you, Nicola. Do you think dentals are something that is often overlooked, and what role can VNs play in raising awareness?
Oh, well, I sort of already said, every animal we see, I'm a very much at every animal or every pet, every time we weigh them, we record the weight, we're doing that clinical exam. So it's a really easy way to get involved. Talking to clients and educating clients is really, really important, just about, daily healthcare, because as a clinic nurse, I want to prevent things from going wrong. And working in first opinion practice, I'm sure most of you have been on the short end of a vet that's sweating because they're doing that dental that's really difficult. We want to make things easy and prevent that. So talking to clients about handling the pet's mouth, just introducing brushing and, getting the paste in, all of those sort of things. If we're doing that early on, then we can prevent, some things from occurring a bit later on in life. So, just getting involved and talking to clients and just highlighting these things is just a very, very simple, easy step to do.
Wonderful.
Nice.
Thank you, Nicola.
And back to you, Claire B. I'm trying to get into a distance learning VN course due to my rural location. I've offered voluntary work to all local vets and have a good solid background in animal care, but no luck so far. COVID not helping. It's not helping much really, is it? But are there any courses I could do in the meantime?
Okay, so I'm assuming this means distance learning for your initial sort of license to practice qualification. So yeah, COVID is making life very difficult for a lot of people trying to get into vet nursing. From that information that you've provided, I would probably recommend looking into doing maybe an ANA or a VCA course first, because there's loads of providers that actually offer that online. And it's a really good start for progressing onto vet nurse training because of all the subjects that are taught, and the little requirement of you being in practice on those types of courses will maybe be a bit more feasible and thinking about progressing out of COVID, hopefully. But it'll give you maybe a good foot in the door in a practice who then may potentially support your training. So yeah, I would maybe look at a ANA or VCA course.
And practices generally are pretty enthusiastic about supporting that sort of training, you'd hope, wouldn't you?
Yes, yeah, absolutely, because ANAs and VCAs are invaluable in practice, so it's very, very much worth investing in their training for sure.
Great stuff. Thank you, Claire.
Okay, Nicola, dentals is something that I want to get into. Are there any books or reference works that you could recommend to get me started?
Ooh, I'm going to say I do a very different side of dentistry than both the Claires. So I know when I was doing anaesthesia and things, I haven't done an anaesthetic for about 10 years, but I know that when I was and helping the vets and everything, I used to use Celia Gorrell's book, which is Dentistry for Veterinary Nurses. But I do remember the thing that I learned the most from was dentistry practical sessions. And we were so lucky. I'm going to say it was at least 15 or 20 years ago. I'm showing my age here. Norman Johnson, who is a really he's like the god of dental stuff, actually came to our practice and spent a whole day doing practical dentistry with us. And I'm going to say I learned more from doing it practically than I ever would have learned from a book. So doing courses where you actually get hands-on experience, I mean, trying to learn how to sharpen a dental instrument from a book is, I couldn't. I'm sure some people could, but I need someone to show me how to turn that elevator the right way and how to do it. So practical sort of courses are really, you know, the gold standard. That's the route that I would really go down. Obviously, books really good from that anatomy and physiology. You know, knowing your anatomy really well is important, but practical things are the way to go.
Wonderful, thank you.
And it's another one for you, Claire B. Aside from the obvious issues of tooth loss and gum disease, what are some of the other issues dental problems can lead on to? I know this has been mentioned by other members of the panel prior to, but just have a go at that one.
I think the main things that I would say would be pain and probably bacteremia, really, is the main issues. So pain, obviously the teeth and surrounding structures are really, really well supplied with nerves. So lots of different conditions cause significant amounts of pain. So fractured teeth, tumours, malocclusions, fractured jaws, caries, tooth resorption, gingivitis, the list goes on. So pain is a massive thing to consider. And you've got to think about how pain can impact an animal's normal daily abilities in a whole different range of different ways. So it can make them inappetent or anorexic, stop grooming, losing weight, not doing normal things, not expressing normal behaviour. And of course, things like halitosis, which is generally what owners first talk to you about, isn't it? Its breath stinks. Yeah, that's not the worst of its issues. And then, yeah, the second thing that I said, bacteremia, gingivitis, when the gums bleed, that's a breach from the outside world to the patient's bloodstream. So if they've got gingivitis and worse, then they've got that persistent low-grade bacteremia. Every time they chew something, every time they eat, bacteria from the oral cavity will be going into the bloodstream, which their immune system has to keep clearing on a very regular basis. And that can kind of, well, it can cause a lot of different things. There's lots of research in humans about oral bacteria sort of systemic effects. So yeah, not just tooth loss and gum disease, lots of potential ramifications from having bad pegs.
Yeah, just a little bit. Over to you, Rachel.
Yeah, so that sounds like that's quite the catalyst for a lot of other things as well, doesn't it? Yeah, I'm staying with you, Claire. I've got another question. Claire B, that is, sorry. What are some of the most common barriers to dentals you have experienced from clients, and how are they best overcome?
Well, I'm sure this will resonate with a lot of people. I think probably clients maybe not appreciating that there's a problem in the first place is often quite difficult, or they think, well, it's old. Of course, it's going to have teeth problems, and they don't really want to do much about it. But and yeah, not appreciating the benefits of treatment, I think. So the way I overcome that is by explaining to them exactly what is going on in the oral cavity, what's going on with the teeth in fairly simple and straightforward terms, and how it could progress. And I find pictures are quite impactful, really disgusting, horrid mouths, showing them this is how it could end up. and this is why it's painful, often does get them on board. But yeah, lots of resources to help educate clients. That's what you really need to be doing to overcome that problem. And I think maybe costs and anaesthetic risks, I would say, are the other things. And I can see in the chat that there's loads of people talking about how they cost procedures. And again, I find clients are willing to pay for the treatment if they understand the benefits, which comes back to the first point, really. And it's up to you, really, with regards to your practice, what payment plans, but it's worth the owners spending the money to get the problem sorted and then trying to keep on top of it. So get the job done, make the mouth comfortable, and then encourage them to spend that little bit of money ongoing to maintain oral health as best they can, and it will hopefully save them some money in the long run. And with regards to anaesthetic risks, I just explain again to the clients, this is the procedure that we go through. These are all of the safety checks that we have in place for your animal undergoing anaesthetics. The drugs are as safe as they can be. Our procedures are as safe as they can be. This is what we will do: IV fluids, IV catheters, etc. And just put the mind at ease, I think. But I would say they're probably the main barriers that I've experienced over the years.
Okay, so it's all about good communication, then keeping those pathways
Absolutely.
open, yeah, and helping them understand.
Communication and education,
yeah,
for sure.
Wonderful.
I've got to say, this has been brilliant, guys. I've got one little 30-second question. Well, not the question, the answer, hopefully. So I'll start with you, but it's for all three of you. I'll start with you, Nicola. If you could give our delegates one piece of advice about working in veterinary dentals, what would it be?
Ooh, I've already said it. Every nurse clinic is a dental clinic. Every animal you see, we need to have a look in its mouth.
Brilliant. And Claire H.
Oh, well, I suppose the next thing that comes into it is patience as well. So I think if you're more patient with dental procedures, you'll start to enjoy it. Really don't give up on things like your radiographs, your dental radiographs, because they're tricky to master, but, you know, keep going, keep at it, keep getting the experience. And just keep learning about it as well, because even, you know, after 15 years and doing all my additional training, I still learn stuff every day in practice, and every client's different as well. So
Patience, certainly a virtue when it comes to dentals.
Absolutely.
Then. And Claire, to you finally.
Well, following on from what Claire said, it's just be inquisitive, always ask questions. What is happening in this procedure? Why is that happening? Why are they doing that? Why are they making those decisions? Always be learning from your vets. And I suppose from a patient's perspective, please do be your patient's advocate when it comes to dentistry being performed. When talking to your clients and trying to encourage their compliance, you're their voice, really.
Fantastic. Well, thanks for you guys, the panel. I think that's some of the best we've ever had. That was really, really good. If it didn't mess with the sound, I'd give you a big round of applause, because there's some great stuff for all our delegates to take away there. So thank you very much for that. We're going to change the pace a little bit now, where we're giving our delegates the option of two Jacks, basically. One is Mr. Jack Fortune, who'll be putting some of you hopefully through your paces with a little bit of a fitness session for the next 15 minutes. And as I mentioned before, VN All-Star returning hero, Mr. Jack Pye, who has kindly agreed to run a quiz. So what we're going to do with the quiz is Jack will ask his questions with a little tiebreaker at the end. We want you to email your answers to us at happyhour@vbd.co.uk by, we're saying 8:15. Just to make sure that they're all in, and we're going to do a little bit of a social media announcement next week as to who the winners are. With the guys and girls who are going to go into the fitness, Jack's been primed to keep a little bit of an eye out for anyone who's putting in a lot of effort. We're going to give you a little bit of a prize. So there's a prize attached to the quiz. We're not going to tell you what it is yet, because we don't really know what it is, but it'd be very good. And ditto with the fitness as well. With reminder, Rachel, about the challenge.
Yep, please keep those challenge pictures coming in. We're seeing so many lovely ones, really making me smile, which is very apt, isn't it, with teeth. So please keep those coming in for your chance to win a £100 voucher. The email is happyhour@vbd.co.uk.
And just before the wonderful Katie Ford splits you off into the groups, I would say to our panelists tonight, the two Claires and Nicola, feel free to take part of the quiz. You may well win. You're not precluded. So no one gets paid a fee. So, you know, you might win something cool. So,
and if you're in the fitness, it's well worth putting your camera on as well, so Jack can see you.
Okay, over to you, Katie.
Thank you, and thank you for such a fantastic panel as well. So at the moment, we have a few of you that already pre-selected that you want to join the fitness group. You will go there automatically in just a few seconds. For everybody else, I've opened up the setting that means that if you do change your mind and you think, you know what, I want to go and join Jack Fortune, being with the chance of winning something there by putting some effort in, then if you click the breakout button at the bottom, which will appear just as I send everyone off, you should be able to select to join that room as well. So we will head off there. I'm going to join that room too, but I'll bring everybody back. Don't worry about leaving when we say it's closing. You will come back automatically. Amazing. Everybody should be heading there now.
The big reveals on the Pay It Forward top tips as well.
I'm guessing this is the quiz one then, everyone.
It is, Jack. I was going to give you, a bit of
the exercise.
You know, no, we're all here to do the quiz, mate. It's been a long enough day for us already, but yeah, I'm not going to. I don't really think you need any build up, do you?
No.
So
don't big it up too much. It might be.
It's going to be amazing. So over to you, Jack.
Everyone will see. Can everyone see my screen?
We can.
Oh, that's good. Good.
I'm already out of my depth, mate.
I was hoping this was going to work, so
it'll be fine.
Good stuff. Cool. So the questions are a bit rogue, and I have had some inspiration from someone else as well. So Lacey has helped me with a couple of the first emojis. So the first slide, we'll move to that one. I'll give you a bit of a time. So there's 5 questions, and they're all dog breeds from emojis. So yeah, enjoy those. The first one I have no responsibility for.
Yes. Are they all linked to the ones? They're all on that list to the left, though, are
they? No, they're not.
Okay, well,
that's just a random.
I'm just going to mute.
So I'll give you a couple of minutes for those.
These are brilliant.
Oh, sorry. There we go. This is how I think Lacey's mind works. I think it's great.
I don't think we're going to need the tie breaking anyway at this rate. They're tough.
So I'll give everyone another few seconds for them. Then we'll move on.
Emoji dog breeds. You didn't see this one coming, Jack.
It's different. I haven't seen it before.
Yeah. I don't like the Siberian Husky. We've got one of them and they're just more hassle than they're worth.
So the answers will not be shared in this session. The answers will be coming next week via social media, but I'm sure that the team would also happily email everyone the answers as well.
Mm-hmm. So that's fine. Right, I'll move on to the next question. A bit more normal. So question 6 is, where is the Jacobson's organ in a particular animal? So there's stomach, pancreas, nose, or eye. It's a bit of anatomy and physiology, which was my bugbear at college.
I know this one.
So, and we'll move on to the next question. So fitting in with the dental theme. Oh, it's just gone back. So how many teeth does a hamster have? So we've got 4, 6, 12, or 16. I thought dog and cat might be a bit too easy for everyone, so I picked something a bit different.
I have no idea.
I mean,
I'm
intrigued
I
as to
thought
whether
they had to- I thought
I'm
they
out of
just
my
had-
depth.
I'm intrigued as to whether the panelists know it or not.
I'd like to think they all know this one, Jack.
I didn't know
I
it.
just thought they had
Definitely know
two, you know, but that's just watching cartoons. I was bitten by a hamster once.
Oh, me too.
Yeah.
I think we all have.
Yeah.
I've got a scar. Yeah.
So next question. So question 8. When did the first veterinary practice open that's been recorded?
Did they have practice standards then?
They probably hadn't heard of dentals then, I expect.
I'm gonna have a go at this one.
Sarah, I love this. I passed out after my own hamster bit me.
Oh. I was only quite young when my hamster bit me, and it bled so much I thought I was going to lose my finger, honestly.
I was saving mine from the cat who was trying to eat it, and a
Oh.
grateful little swine bit me on the finger as I picked him up. Well, thumb actually.
Cool. Next question is question 9. So how many bones does a dog have? I never knew this either.
Oh my goodness.
I suppose for the fast counters among us.
Yeah, I gave you a hint. There's a diagram there to go off. So question 10 is how many claws does the average cat have?
Somebody show my ignorance here, don't they just all have the same amount of claws?
Some cats have opposable thumbs and whatnot. So
Okay.
Just off to count my cat's claws.
everyone's
Back in a moment.
I'm sure it'd be making itself scarce, Rachel.
He has. He's disappeared because I stole the chair back from him. He wasn't happy.
Cool. So question 11. How many hearts does an octopus have? This is probably quite a common quiz question actually, but it gets me every time.
Have you ever done anything with an octopus, Jack?
No, never. I actually find them quite scary. I think
They're very clever, aren't they?
Yeah.
They're meant to be very intelligent, aren't they?
Guessing the football results and all sorts.
Yeah.
Yeah.
They're fascinating to watch, aren't they? Octopuses? Yeah.
Yeah. So next question. So that's question 12. And which animal has the longest gestation period? Don't know if anyone's ever seen any of these in their career or not. Any zoo nurses? I expect Matt Rendell might have seen some of them.
The legend.
So question 13, 14 and 15 and 16 are all instruments. This is going back to Aussie days now where I had to put them all on a grid.
I was looking down there and I looked up, I thought I was in the wrong kind of quiz and thought I was going to see guitars and saxophones and things. And again, I've no idea.
Know what 16 is. That's it.
I bet they're not called what you think they're called.
No, I bet they're not.
There'll be a proper veterinary.
Tweezers.
Is that what it is? He made his own quiz.
Wheeler.
Okay then, Rachel and James, just so, because other people, are writing down their things and getting sorted. What would, if you could just name what you would use these for, what would they be?
Oh my goodness.
Well,
It doesn't have to be animal related. You can just give us what would the names of these be?
the number 13 for maybe picking up small nectarines.
Yeah, like that. Yeah.
Or gingerly picking up a pear or a peach.
It looks like you separate something with it, maybe.
Number 14 could be a very small sort of croupier thing for moving across a roulette table, little counters. for small, I don't know, if animals in those old pictures you used to gather around, you see them playing cards, maybe a Dalmatian slowly pushing the chips over to to the evil Whippet, who's just
Or you could use it to
just
pull something
broken
towards you.
the house. Top right, it's got me, and number 16. I mean, they are just tweezers, and I don't think I'm ruining your quiz saying that, Jack.
I hope to God, no, none of the vet nurses have written tweezers on there.
Just don't listen to me. I mean, it's the only one I thought I'd got right. I didn't, did I? So, but yeah, so it's very
Some
precise
sort of
looking
poking
instrument.
device for 15.
A what device, right?
A poking device, just.
Yeah, possibly. Might be. I mean, if you just wanted to poke someone, would you really use that thing?
I think you'd get their attention
I
more
mean, you
than
could
that.
get done for assault. I mean, if you'd have to poke them
Have to
with the
be
other end,
careful, yeah.
with the other end, or
I think there should be like a prize for like the best name of these that
a nectarine
isn't true.
extraction
Yeah,
device.
The nectarine gets it, doesn't it?
yeah.
I
And
think
remember to email all your answers when you have got them in to happyhour@vbd.co.uk, and you have till 8:15.
Oh, I liked Sarah McCain's suggestion of shoe puller honour for number 15. Very good. Yeah.
Back scratcher. Yeah.
I do like a back
Amazing,
scratcher.
right?
I want to see someone reenact number 14 on a poker table with a Dalmatian now.
Yeah. Well, if anyone wants to draw that for me, I'll happily pay 20 quid for that. Send that in to the same happyhour@vbd.co.uk, because that's going on my wall.
And we've got that on record, guys.
That's fine. Yeah, it's very, very rare that I ever offer to give anyone any money. But yeah, if someone could do that, would be fantastic. Has to be a Dalmatian, though. Has to be a Dalmatian. To a Whippet.
Oh dear.
That's just what I've got in my head.
Right, I will move on before there's some more wacky ideas. Question 17 is, what is the most common cat disease seen in practice? And they're very unimpressed looking.
Doesn't look pleased, does he?
Looks furious. He's got a slightly Churchillian air about him, actually. About that face.
I don't know if it's like the official, like that. There's that grumpy cat, isn't there? So I don't know if
Yeah.
it's anything to do with him. Yeah. Cool. Right. So question
Doubtable
18
little fellow. Oh.
is
Oh,
name,
he's sweet.
name the breed, and there's a clue that this breed particularly can't bark. Again, that was another college question they like to throw in our exams. I don't think I've used it.
Do they make any other noise? Do they do something apart, instead of barking?
Oh, now you're asking.
Do they like yip or?
I think this is the only time I've ever used it since being at college, actually.
I haven't got a clue. It's a lovely looking.
Cool. So moving on to question 19 is, how many chambers does a snake's heart have?
I don't know about you, Rach. I gave writing down any
Oh yeah, no. I've got no hope.
And then I would hope to God that you know the last one, so you might be with a chance at least.
Oh, okay.
And so question, oh no, it's disappeared. Oh no.
Oh no.
Question 20 has, oh no, there's question 20.
Yeah.
There we go. So who is the current RCVN Council Chair?
I do know that one, yes.
And then I will give you all the tiebreaker question as well. And that's just, the tiebreaker question will just be writing it down to the nearest number. And then if there's anyone who is matched on the same answers, which I'll be impressed if there is, I'll say, then they'll go for the nearest number. So the tiebreaker question is, how many Labrador Retrievers were registered with the Kennel Club in 2020? I have no idea.
Too many. That's the answer.
Yeah.
Lockdown Labradors.
Too many.
Well, they are lovely dogs, though. Jack, that was amazing, mate.
Very.
You've got a future there. as a, I think, on a grander stage even than this, as a quiz master. Just need to get yourself maybe a fancy shirt. As I say, I think I got about 3 of those right, maybe. We got the last one though, and I'm sure we did a story about the number of kennel club registrations of Labradors recently, but obviously, as an employee of your organisation, I can't take part. I hope you all enjoyed that. Are we? I mean, thanks, Jack. That was brilliant. I really enjoyed it.
Great, Jack. Well done.
No problem.
I didn't know most of the answers, but are we getting the guys back from the fitness?
Yeah, so 30 seconds they will come back in. So again, happy hour at vbd.co.uk. Get your answers in within 15 minutes. So literally, if you've been scribbling them down, then quickly get your phone out and start writing them into your phone. Doesn't have to be neat. And get them submitted. You've got to be in it to win it. So happy hour at vbd.co.uk.
We'll be sending out some excellent goodies to the winner of the quiz and the reddest face from the fitness session. I think you'll be joining us shortly. You suggested earlier the beetroot prize, Ebony.
Yeah, I think you just need to, you need to set out some cooked beetroot and something obviously more enticing than that.
Yeah.
But I'd be quite happy if someone sent me some beetroot.
They want to be on 1-day delivery though, wouldn't it, I suppose? I guess all jarred. There are options. Okay, we got everyone back in the room?
We have, I think. I believe we do. Yes, we do.
We are approaching the end of proceedings, but before we have, you've been sending us for 2 or 3 weeks, been amazed by the quality of entries, haven't we, Rachel? And throughout the night of your smiling pets. And there is just a small selection of our entries. They're absolutely incredible. We love them all, but we had to pick one winner. And the winner of our £100 prize, drum roll, Rachel, is Diane Westwood. Congratulations, Diane.
Yay, congratulations, Diane.
I mean, that's a smile and a half. But it looks great. We love it. Good teeth. So congratulations. And over to you, Rachel. To
so it's on to our top tip winners. And again, you've been sending loads in and they're always so interesting to read. Got a few of them up on the screen now. But we can only have 2 winners. So we have got, get another drum roll going.
Oh, sorry.
Thank you. Right, so our winners are, we have Rachel Taylor and we have Jenna Joshi. Now, Rachel's tip, you should be able to see it up on the screen now. Keep the inside roll of an empty wraps bandage to use as a lightweight splint for rabbits' ears when cannulated. And then Jenna Joshi, for our angry patients when recovering from anaesthesia to maintain IV access, but also save a lot of fingers and stress, remove all tape carefully, leaving IV still in place with a bung. Place a pressure bandage over the IV. When the patient is fully awake, just pull the IV out. This saves a lot of stress trying to remove it while the patient is awake. So thank you for those. You each win a £50 voucher. Congratulations.
Yeah, well done. Some good tips there. And we do this every month. We've done it from the very start. Thanks to the lovely Lacey picture, which is our Pay It Forward nominations. Again, we get tons of these. We get tons of but here's just a few of them. You're all worthy winners because, as we said before, it's been a tough 18 months for everyone. But we can only have one winner a month, and that is Danielle Smith. So we will be sending a bundle of loveliness, paying that forward to you. Lee and our wonderful marketing team will be making some inquiries to select what's going to make you guys happy. So we'll be getting that to you, Danielle. And that's pretty much it from us. Just thanks from everyone, the panel. So that's the 2 Claires and Nicola. You guys are amazing. I think that's one of the best panels we've ever had.
Amazing.
And I think it's certainly the best quiz we've ever had, Jack.
Yeah.
But it was fantastic, mate. It's just great to have you back on. Next event's going to be on the 26th of August, isn't it, Rachel?
It is indeed, yep, and you can register for that now. The link's up on screen, but we'll get it in the chat box as well.
And it just remains for me to thank our sponsors this evening, Bought by Many, and Katie, and Ebony on tech and everything else. You guys are amazing, but most of all, the delegates, you guys are brilliant. You really make this what it is. All the ideas, the topics, the questions, the top tips, everything. It's all about you guys.
Yeah.
You know, we're going to carry on doing this. And it's just incredible that so many of you come every month and support it, but it's for you. So we're going to be putting the same questions out again. We want you to send for our next event, which is again on the 26th of August. So make sure you're there. And just thanks everyone for coming. It's just been an absolute pleasure.
Thank you so much, everyone. It's been wonderful.